starting the recording now for those of you who are waiting for that. Oops, we're in Inception here. It's playing YouTube on my computer. Okay, I'm going to get us started now. My name is Brittany Whitley. I'm the Executive Director at Most Policy Initiative. Again, thank you so much for being here. We're really excited to have this panel gathered today and all of these new friends here to join us in this conversation about food access and food insecurity in Missouri. For those of you who haven't been to a Most event before, just a little bit of background about us. We are a nonpartisan nonprofit group who's really interested in improving lives for all Missourians by connecting science to policy information. So we don't do any sort of policy advocacy at Most. We're really kind of trying to be these honest brokers of scientific information. And through these roundtable events are really trying to connect folks in our communities to people who have expertise in certain areas, to also talk about how we can use science to have conversations with our lawmakers and decision makers. As we have some of our last panelists join in here, I want to get started on introducing the panel that we have right now. Again, really excited to have this group of people here. Final housekeeping for any of our audience, please keep your microphones on mute and use the chat function to ask any questions you have. We'll try to get to questions mostly at the end, but I'll keep an eye on that chat throughout, so we might be able to get through some of them during. Okay, so first let's start by introducing Dr. Daniel Othar. Dr. Othar, do you want to give us a quick background about yourself?
Yes, I'm a professor of environmental health engineering in Rolla at Missouri S&T. I work on nutrition domestically as well as overseas, and I really work on the three aspects of food. When you think about having not enough calories where you're starving, or think about when you have too many of the wrong calories where you might be suffering from obesity, or thinking about having not the right kind of nutrition. And so those are the kinds of problems that I work on with my engineering students. And one of the things that we work on is how do we design food systems? And we've been working on a redesign of the food system for Phelps County, Missouri, right here where Missouri S&T is based.
Fantastic, thank you. Next, let's introduce Kelly Mcgowan, who's the co-founder and director of Built Advocacy at Evolve in St. Louis.
Hey, good afternoon, everyone. This is Kelly Mcgowan, and I serve as the Director of Built Environment Advocacy for the entity Evolve, which stands for Elevating Voices of Leaders Vying for Equity. And in this role, I mean, we have a lot of things going to really shake things up. Our mission is to create a community-driven platform that brings about the creation of equitable built environments for all St. Louisans, which also includes the food environment. So we really work to just empower communities to advocate effectively for what they very much so deserve to ensure that they thrive.
Fantastic, welcome Kelly. Next, I want to introduce Bill McKelvey from the MU Interdisciplinary Center for Food Security.
Hi everybody, it's great to see everybody today. My name is Bill McKelvey. I'm based in Columbia, Missouri with the University of Missouri Interdisciplinary Center for Food Security. We have a number of projects going on at any one time. Right now, we are working on creating a web application for our Missouri Hunger Atlas, which will enable a little bit more kind of user interface. Folks will be able to select their own indicators and years and kind of produce some of their own results from the data that we've collected. We're wrapping up a rather large research project involving food pantry directors and agencies across Kansas and Missouri. We'll be able to share more information about that around April 2022. We also have a community engagement program where we help communities talk about the food system, develop an action plan, and really kind of help them kind of reach their own goals in terms of what they want to see with their food system.
Great, thanks so much, Bill. And next I want to introduce Dr. Ellen Barnage from St. Louis University.
Thank you. Brittany, thank you, and Agazi for the opportunity to be part of the panel. I'm Ellen Barnage, a faculty in the College for Public Health and Social Justice at St. Louis University. And given the topic today, I thought I might share with you that my work thinking about the food environment dates back to the early 2000s. So I was part of a research team led by Beth Baker at SLU that audited grocery stores east of Highway 270 in St. Louis. So I can confidently say that I have probably been in 80% of the grocery stores that were there at the time. We were determining the selection of food items available that met dietary guidelines. And then several years later, we also audited stores in Southeast Missouri. So this work was even done before the Environmental Food Atlas developed by the USDA came out. So it allowed us not only to think about availability, but it also helped us think about our food shopping context. And then more recently, and I got booted out, but Kelly probably talked about it a little bit, a former graduate assistant and I, Allie Siegler, along with the St. Louis Food Policy Food Access Working Group, developed a corner store audit tool that looked at availability and affordability for items that met SNAP stocking requirements. So that's what we've been working on. I do want to say that when I think about food security, I really think about it in 4 dimensions. One is the availability. So where's food located within a community? Not just in grocery stores. I think about access. So can people get to the food that's available and afford it? Adequacy. Can people get enough food in order to support their health, not just to reduce immediate hunger? And then agency. Do people have choice in the food that they eat? So these are the dimensions really I think about, and many others think about too, as we approach food related work.
Thanks so much. And we are still expecting Representative Collins. We should get her soon. And so we'll get started and then do a quick introduction once she joins us. So I wanted to get started. I think when we have this conversations, one of the things I've noticed when we're talking about access to food is there's a lot of kind of terminology that all sounds similar, but is actually pretty different and changes how we're talking about things. And so I was hoping that somebody could help us get started by helping us define some of these terms. So what are the differences between talking about food insecurity versus food deserts and food access? Kind of what do these terms mean and what's important to be thinking about as we have this conversation?
I think Ellen did a great job with outlining some of them. I think one thing that's interesting to think about is kind of the USDA definition of what it is to be food insecure in the United States and how different that is than other definitions. I think a lot of times we think food insecurity and we kind of go to the stereotype of somebody somewhere who's starving. And that of course is horrible food insecurity. But if you're not quite sure where your next meal is going to come from and you have that experience one time in a year, then you've experienced food insecurity. And when we're talking about younger children in particular, we're talking about people that might have, some other things that they're facing in their life. That can be really scary to not know where your next meal is going to come from or if that next meal is going to be adequate. And it can lead to a whole lot of behavioral responses because of that, danger of where's my next meal going to come from.
I would also add too that when we think about food security, we can think about the physical location of food. We can think about do we eat to not feel hungry anymore? Do we eat to be able to support our health? Are we able to afford food? And if so, what food are we able to afford? But then I think that there's other ways we might think about it as well. Can I eat in a way that supports my family's traditions and ways we celebrate and honor and gather together? So there is the USDA definition, but then I think we really have to dig deeper for that to be meaningful to a lot of people as well.
I think that's a really great point.
Oh, I wanted to add to what Dr. Barnage mentioned. it goes beyond access. I just feel like it's choice as well. I think everyone deserves the option to whether they want to have a greasy burger or some good old fried chicken every once in a while, but also have the opportunity for those healthier options. So really being able to have the option to choose. I think that is really what everyone deserves, no matter where you live, whatever your zip code or what have you, but to have that option to choose on where you want to eat and what you want to eat. And unfortunately, a lot of the communities that, I've been able to work with, we don't have the choice. This is what it is. And we have to go outside of our communities for better or healthier or more variety. And so I think that's something that kind of gets lost in this conversation as well. I wanted to lift up.
Thank you so much. So I want to turn this over to Bill, because Bill, you mentioned something, and Dr. Oather also talked about this in the chat, how this is a useful resource, this Missouri Hunger Atlas. Can you talk to us a little bit about some of these kind of broad statewide trends? I know that the atlas is long, there's lots of different relationships that you looked at, but can you kind of talk big picture here, some of the big takeaways you have from the 2019 atlas?
Sure. So, basically with the Hunger Atlas, we document at the county level where there are pockets of food insecurity and higher need. And a lot of times when we're looking at need, we're looking at income. And so are people eligible for programs like SNAP? Are they eligible for WIC? Are they enrolled in the National School Lunch Program? And then on the flip side, we're trying to gauge performance of those programs. It's one thing for people to be eligible for a program. It's another thing for them to participate. And so we then estimate of the eligible population, how many folks actually participate. And that gives all of us, policymakers, advocates, researchers, community members, a tool essentially to understand which parts of our state are doing better or worse compared to other parts of our state. And so in that way, it's a comparative tool. And if you kind of step back and look at the Hunger Atlas, one of the first things that I tend to notice is that areas of high need tend to be kind of persistent areas of high need. So there's a band of counties up in the northern part of the state near the Iowa border that tend to be high need, parts of the Boot Heel in southeast Missouri, parts of the Ozarks, and then also our primary urban areas, Kansas City and St. Louis. But if you look a little deeper, and we try to encourage this, we see that places in our state, especially the suburbs, so around Kansas City and St. Louis and around Springfield, have what is apparently lower need compared to other places in the state. But if you look at the total number of people affected, it tends to be a lot of people. And so I think it's one of the lessons with data and using data is that we don't want to forget a place just because, say, the percentage of people who are food insecure is lower in one place than another place. We have to take into other factors like population. And one more point, we find that in some of those suburban areas where there are a lot of people affected by food insecurity, those are often areas where the performance of those programs that I mentioned, SNAP, WIC, school lunch, are not performing as well. There's not as many people in that eligible population who are participating. And so you have a gap. But there's a lot of information. I encourage folks to check it out, and I'd be happy to have discussions later if folks have questions.
Great, thanks so much for that overview. Something that you started to talk about, and so I want to kind of shift gears a little bit here, is thinking about food access and food deserts looking differently between rural areas, urban areas. I think sometimes some of us think only, food deserts only exist in urban areas, or you can imagine them in a rural area, but not in the middle of the city. And so can one of you talk a little bit about kind of how some of the causes and impacts of of food deserts and food security are different in these different areas. Bill just talked a little bit about access and utilization of some of these public assistance programs. What are some other ways that there's important differences between urban and rural and suburban areas?
One of the things that my students have noticed when we've looked at the Phelps County, right? I mean, you would think Phelps County, Missouri, right there on Interstate 44, you're just right in the south center of the state. It's mostly rural. And so there's plenty of grass-fed cattle wandering around, but there's an awful lot of folks that are eligible for programs that don't sign up for them. And so I think this kind of comes to Kelly's point earlier about the choice, right? So if you can get food, but you feel like that food is given to you as opposed to something you've earned, we've found in our interviews with some folks in communities that they'll be resistant to take that needed food or participate in some of those programs, thereby kind of creating a food desert for themselves because it's not the choice that they want to in terms of earning some of their food versus having having different kind of food access. So it's really interesting when you have a person-centered view and drill down and say, well, how is that person food insecure?
I would just add to that too. That's interesting perspective, Dan, in terms of thinking about our beliefs about access and choice. I think one of the other things we need to think about is the intersection of our systems. So transportation systems look really different across the state. So we have state and federal policies that are supposed to be implemented for everyone, and yet our contexts are really different. So public transportation looks different. If you have the summer food service program and you hold it at a school, the distance between families traveling to that school depends on where you are located in the state. So how do you get folks to that site? So I think you also have to look at these other systems that intersect that can create barriers to access as well.
And something else I would like to add, speaking to the urban suburban space with regards to this topic, really understanding history too, and understanding that context. I know in the St. Louis area, you have history of, just racism that has resulted in zoning, redlining, a lot of systems that were in place and designed to really not ensure that we all thrive, especially Black and Brown people. And then you have, the building of highways, which decimated communities, Black communities in general, to create suburbia. And when you have populations of white residents, they leave on the highways to suburban centers. The businesses went with that as well. And so we kind of see that trickle down effect, that lack of investment in these communities, and it exacerbates. And so I know in the work that I've been able to be part of, working with communities, previous to Evolve, my wheelhouse was in programs, wellness programming, obesity prevention programming. And I thought it was great, co-creating programs with moms in North County around healthier eating. But while we're in the midst of creating these cool programs, really having an impact on family eating habits, grocery stores were closing down in North County. So it's programs are needed for sure, but if we don't really address, again, the systems in place that really make it difficult and challenging to facilitate these healthier eating behaviors, we're really doing a disservice to communities.
I concur with everything that's been said. I had some of those in my notes as well. The only thing on my list that I wanted to mention was this idea of I think this especially impacts rural areas when there's a low population density. It becomes hard to support a store, and especially small stores. And another kind of related point that I've come across is this idea of sort of minimum order thresholds and how a small store has to place an order of a certain size at times to either get a cost break or to even be serviced by a distributor. And so there are some things kind of built into the grocery industry and how food gets bought and sold and moved around that impact areas as well.
I really appreciate all of this context. I think it's really important as we start to think about solutions to understand what some of the causes are of the challenges that we're facing in order to make sure that the solutions are meeting the problem. And so I want to go into talking a little bit about impacts. And so I want to start with Dr. Barnage. I know a lot of your work is kind of focused in the health space and this intersection between kind of food security, nutrition, and public health. And so can you talk a little bit about what does it mean if someone's food insecure? What does that mean in terms of kind of health outcomes? What do we know about that? Oops, I think you're muted.
Thank you.
It has to happen at least once.
I know, we have so much practice and yet it still happens. I think one of the things that's important for us to think about in terms of how we look at the research is that food insecurity can be measured a lot of ways, but the way that the USDA measures it is at the household level. So when I talk about this, it's really thinking about individuals in a household. And mostly the work that I've been doing has been around children. So that's sort of where I focus those outcomes. But we know that children that live in food insecure households are more likely to experience both worse health outcomes, behavioral and social outcomes. So living in a food insecure household for children has been associated with things like asthma, iron deficiency anemia, low birth weight, poor diet quality, poor educational performance, and social emotional challenges like hyperactivity. And we also know that there has been an association with mental health as well in terms of anxiety and mood disorders among children. So one recent study that we've done looking at the youth risk behavior survey data that assesses health risk behaviors among 9 to 12th graders, we found that student self-reported hunger, so this is different than the USDA measure, but this is high school students saying I experienced hunger, was associated with a greater prevalence of current smoking, sexual debut before 13 years old, and dating violence, among other outcomes. And then in a related study, we also found that Black male youth had greater prevalence ratios for mental health outcomes, including suicide. So these are significant health outcomes. We also see worse outcomes in adults and older adults who live in a food insecure household. And it's so significant that healthcare systems are really beginning to say in the last 10 years, there's been many more interventions that both screen for food insecurity and also have put in place food prescription programs as part of patient care. So I see Trina from Operation Food Search on here as well. So I know they've been doing work in that space, but it's just interesting in terms of other systems that are recognizing the importance.
And then Bill, are there any other statewide trends in this kind of intersection between food access and health that you wanted to cover? I know you covered a lot of those already in the first piece, but I wanted to give you a chance to jump back in here.
I think I'll just add that, and I'm not sure if I said this already, but when we kind of look at our maps and overall, it appears that, poverty is quite often one of the largest predictors of food insecurity and negative health outcomes that we evaluate in the Atlas. And we know that there's a lot that goes into that, and there's a lot that can be unpacked as it relates to social determinants of health and how where people live affects their health outcomes. We don't necessarily get into that in the Missouri Hunger Atlas, but we do provide some health information related to diabetes, hypertension, and high cholesterol and things like that.
Thank you.
I think it's also interesting to think about how people feed themselves, right? I mean, that's one of these things that we don't often think about maybe in as urban or a suburban setting as much. We do when we get into some of the urban garden kind of space. But in rural communities, the idea that, hey, it's the autumn and I am allowed to go hunt, or it's the spring and I'm allowed to go fish. When you actually go out and talk with people about where they get their food from and how they handle their food, you'll find lots of folks in rural communities doing things like pitching in and 2 or 3 families together, buying a whole cow, having it butchered and putting it in a freezer for the entire year. So, there's very different approaches to food in different places. And that kind of granularity, I think, can make it difficult for a one size fits all kind of approach, right? Because it's different policies for different kinds of choices. And I think sometimes we get pushback from folks because we kind of lump it all together in one case. And I think sometimes it's helpful if we get opportunities to listen to each other more about what our each individual's preferences and choices are, and are respectful in that space. I think we can make more progress.
I wanted to open this up before we switch to solutions, which is where I want to spend a lot of our time in the conversation today. Are there other impacts of food insecurity that we haven't talked about? So, I know Dr. Othar, you work in this environmental engineering space, and so potentially there's some kind of economic or environmental impacts, also potentially social impacts we haven't covered in the health space. Health is usually, it's what comes up first when I've been doing a lot of my research. I think it's a very important piece, but are there other impacts of food insecurity that we haven't talked about yet that we want to cover?
The environmental impacts of our food supply are huge, right? I mean, everything from, political statements where we say things like, let's decarbonize our economy. Well, I'm sorry, food is carbon based. So unless you want to get rid of people in food, you can't decarbonize your economy, but you can perhaps maybe switch to more reliable or more sustainable energy supplies. So you have to be really careful thinking about what it is you're saying. And we teach our kids when they're little, when you leave the room, please turn off the light, or when the air conditioning's on, please close the door. And a lot of times we don't realize that what they put on their plate 3 to 5 times a day, depending on whether they're grazers or meal eaters, has a huge impact on the overall planet. And so helping people learn to vote the environment with their feet in terms of what they put on their plate is tremendously important. Not to step in and tell people, not to be sensitive to their choices of what they want to eat. I think the whole panel's, emphasize that point a lot. But I think a little education can go a long way towards saying to people, there's benefit to turn off the light when you leave the room. There's benefit to thinking about how much meat you're eating. There's benefit to thinking about, are you eating local food that's seasonal? I noticed in the chat, we had some people saying, wouldn't it be great if we ate all the food that came from Missouri? I like orange juice. I wouldn't get a lot of orange juice if I only ate food that came from Missouri. So, unless we'd had a lot of hot houses or things like that. So it's interesting to think about where our food comes from and how we interact with it.
All right. So in the second half of the roundtable, I really want to shift towards kind of digging a little bit more into these solutions. So at most, we're always talking about evidence-based policy solutions. We want to give our policymakers and decision makers the best tools that they could possibly have, given that I think the folks on this panel, for example, think a lot more about food access than many of our legislators. Representative Collins excluded. She's done a lot of great work in this space that we'll make sure to highlight when she gets on. And so I wanted to shift and talk about what is Missouri doing right now in this space to improve food access? And I wanted to start with Kelly, because I know that you're doing work at Evolve, but you've also been involved in other programs you mentioned before. So there's the We Do program, kind of focusing in the obesity space. So can you talk a little bit about some of the work you've seen and how that's been effective in the communities you work with?
Yeah, so one of the things that I will say, it seems like people really are taking a step back to understand the bigger picture and actually work together. Slowly but surely, we are collaborating much more in the space because this is a heavy load. And so through my work with We Do, working with a lot of partners through Missouri Foundation for Health on statewide initiatives, really looking at how can we move the needle in improving health outcomes, looking at what people are eating, and working with schools. I mean, that whole Healthy Schools, Healthy Communities initiative, we worked with communities in North County and partner with school districts to really figure out how can we support one another, not only to prevent childhood obesity, but to really ensure families are engaging in healthy behaviors and supporting them. So, that was an awesome experience. And we have partners also in rural parts of the state. And again, things look a little differently, but a lot of the issues and the things that we were addressing in North County were some similar concerns that people were having in rural parts of Missouri as well. So, but we were able to kind of bridge that rural urban divide a bit and really figure out how can we, what's working in your neck of the woods. Maybe this is something we can try here, tweak it a little bit to fit our population, our communities, but kind of go from there. And moving forward with Evolve, again, talking about collaboration and working together. Dr. Barnage, Ellen, we're working on some awesome work through our food audit toolkit. So working with her at SLU and also the City of St. Louis Health Department in really figuring out how can we come together to empower communities to assess their food environments, collect that data and that information, analyze it, and really figure out how can we engage the businesses in our communities around having more healthier options. How can we engage our local decision makers as well in this process? Hopefully Representative Collins can hop on because we've had a lot of conversations around that, and also at the county level as well. So we've engaged everyone on all levels, the community, residents, our anchor institutions, our health departments, our local health departments, as well as the business community to come together and say, hey, we know there's a need here. This is what we have in front of us, but how can we move the needle and working collaboratively to come up with solutions that are a win-win for everyone? And that's something that we really like. We're intentional about expression to businesses. We're not coming into businesses trying to shut you down to see what's wrong. We're really trying to see how can we work together to make things better. The businesses will definitely, they'll greatly benefit out of that by providing increased variety. Also working with us, maybe we can connect them to other vendors or just other sources of where they can get those healthier options and fresh produce. Hey, maybe even at a better price for them. But I know that that's a lot of work I'm really excited about is we're learning to work together. It's not, baby steps, but I can confidently say in the work I've been able to do, been able to partner with folks from different sectors to really tackle this huge issue because it really is a heavy load.
I'm going to open this up to the rest of the panel, but before I let you guys jump in, I want to remind our participants, please, if you have questions, put those in the chat. We're going to have some time at the end here to get to those questions. And so if you put them in the chat, I can ask them. And so for our other panelists, what are some other evidence-based solutions that, in a perfect world, you would like to see kind of implemented? And again, recognizing that we're not going to come out of this with one silver bullet policy. If we pass X bill, we're going to solve, food insecurity in Missouri. But based on the work you've done and things that you're thinking about, what are some policies you would like to see that you think could have a really big impact on food access in the state?
I think a couple of things come to mind. So one of them is kind of simple, but it's a big deal. Like, how do we improve and raise incomes for individuals and families? I think that goes a long way to addressing a lot of these issues. In addition to that, making sure that we have strong and accessible food safety net programs so that people do find themselves in difficult places, they have the resources to not slip further behind. I was excited to hear Kelly talk about the community engagement and community input piece, because I think that is also really critical. That's time intensive and resource intensive, and it takes a lot of sort of caring, I think, to do that. But I think that that's really very critical, especially when we're thinking about this idea that, you know, like a grocery store being put in a particular place may or may not solve the issue, right? Like people shop at places based on lots of different reasons related to price. Does the place have the food, types of foods they like? Is the environment what they like? I mean, there's a whole host of things that go into like why people decide to shop in one place or another. And so just putting a grocery store may not solve the issue, but if you're having community conversations and you're figuring out what the community wants and working with existing businesses like Kelly described, I think that's just so important. So I'll stop there.
You know, I think one of the things, you know, and maybe being an educator, I then kind of push for education, right? But you know, little experiments, like for example, one of the things that I've done with students, you know, if you take some students and give them $100 and say, now go figure out how to get $100 of groceries home on public transportation, right? Do that on the bus and somehow transport, you know, whole foods that you're going to have to prepare that are carrying all that embedded water. Or you take folks that are in urban areas and you say, now let's grow the food that you're going to eat on your plate, right? I think sometimes we all think that it's so much easier to do the other person's job, right? I mean, and imagine if we were in the world of haircuts, we would all end up with, you remember what those COVID haircuts looked like. They were pretty bad there for a couple of months. And I think sometimes when we are thinking about food access and we think about folks that are approaching it differently than we do, we don't really understand what kind of challenges they're having. One of those areas that we didn't touch on at all in this, but the mental health issues that are related to food and the hoarding behaviors that can be related to food, and you know, the adverse childhood events that can be related to food insecurity. There's a tremendous overlap that can have profound implications and can make it seem insurmountable to solve food insecurity for some individuals, but can tremendously exacerbate the implications of food insecurity for generations for other individuals. So I think in terms of the solution space, us kind of the walk a mile in the other person's shoes and understand a little bit about where they're coming from can go a long way towards us having policies that can be granular and can respect the individual choice and be person-centered.
I would also add to that, just to lift up again, Kelly and Evolve's work and others. Not only is it community engaged, it's community led. Regardless of the community, I think solutions need to come from people who are living in the communities where access is most limited and where outcomes, you know, are most detrimental. Sometimes policy is made blanketly and it's trying to take into account the most people, but it's not necessarily considering leadership within communities that are most effective. And so that's one of the reasons I think the work Kelly's doing and others in the St. Louis area, but I've also worked with community coalitions in the Boot Heel and Ozark regions. There's a lot of solutions that folks have that they've already been implementing that maybe aren't scaled, but they're strategies they've been using for a long time and to get the food that they need. Should we be constrained in the ways that we have choice and access? Absolutely not. But there's also creative things that are already happening that we need to lift up. So I just kudos to Kelly and others who are doing this work. And I think the other thing that we need to think about, and Elena Patrick is in the audience as well, and she's really taught me to think about what do we already know? How were policies created in the past that have contributed to where we find ourselves now, and how can we think about policy making in light of that. So sometimes in public health, we talk about health in all policies, but sometimes we don't really think about, as Bill talked about, raising incomes for folks. Well, when we think about that, are we also thinking about the impact that might have on food and health? So those are just some additional things.
It's come up a couple times, and I want to get into this maybe a little bit more. I think our participants here is about 50-50 split between kind of people on the research side of things and then people on the community leadership side of things. And so I think Kelly's been brought up as a really great example, and Evolve as a group that is kind of working together within communities, doing leadership there, and then also working with scientists. It sounds like Kelly and Dr. Barnage, you guys have worked together on projects in the past. Can you guys talk a little bit about, and so we'll start with Kelly here, how a researcher who wants to get involved and kind of use, help create or implement solutions to a problem, like what are the most effective ways for researchers to engage with a group like Evolve? And what are things maybe that people have done wrong in the past or really well in the past that we can learn from to make these interactions more effective in the future?
For sure. First off, I will repeat, do not engage with an organization or community, say, hey, I have the solution to your problem. This is real life, true story. This has happened before. I have received messages via social media of folks reaching out and saying, hey, I have a solution. Don't do that. You will fail every time. I think sometimes people really overthink things and make things way more complicated than what they have to be. And think about just as people, how do you connect with other people? You show up consistently, you don't have any ulterior motives, and you're just there and you share space with folks. And that's basically it. I think sometimes on the researcher side, it can be a bit overcomplicated. At the end of the day, we're all people, we're all humans, and just really take that into consideration in engaging groups and engaging people. The way you reach out to a community or engage with the community, is that something that you would find valuable? Is that how you would want to be approached or treated or engaged with? I think it's just, we're all human. So just keep that into consideration and listen to people. Just listen. I think, in the communities that I've been extremely grateful to be working with, sometimes folks, they just feel ignored. They feel that no one listens to them, that they aren't valued or valuable. And providing that platform or in that space for community members just to get their issues off, to vent. I think sometimes that's just what we need to do, is just listen more and engage in meaningful conversations with one another. It's really not that difficult, you all, I promise, because we're all humans.
If I could add just a bit to that, there's also discussion about when there's money involved, and if communities are being asked to contribute time and effort to projects, they really ought to be compensated. So, that happens way early in the process, even before the proposal is put in, but that's, I think, another consideration.
We have a question in the chat here from Lauren Fitzpatrick. Thinking especially on the community engagement side, do you find homeowners tend to be more involved than renters regarding food access? Potentially too, one of the things that this question reminds me of is thinking about urban agriculture and urban farming, kind of who has access and ability to create the spaces to grow food in those gardens. Any of you are welcome to field that question.
This is not an evidence-based response, but food is something that everybody needs to live. And so I think everybody has a stake in it. And whether you rent or own or stay with somebody else or whatever that looks like for you, I don't think that that really makes a difference in how people engage, and that might be contextually based, but in my experience, that has not made a difference.
So being in a fairly unique community where a third of our population is only here for 9 months of the year, right? Phelps County has got this, massive exodus that occurs every summertime for those 3 months when all the college students leave. When we've engaged with folks in the community to think about how do you redesign food systems, it's actually very important to think about that transient nature, not because they're not interested or invested, but because the coming and going will lead to different abilities to be engaged. And so, we can look at that and think about it in the context of students, but there are numbers of transient populations across the state, across the whole country, and thinking about how those transient populations move and work and the impacts that have on the food systems, I think is important. I certainly wouldn't think that people have less right to a voice because they're not there all the time or because they're in rented space. They might have a different perspective to share. And so I think that's really the key to look at.
We have another question here in the chat thinking about access to benefits like SNAP. And so one of the questions that's raised here is that how do you suggest we combat the issue of kind of broadband lack of Wi-Fi access for people to go in and actually apply for some of these benefits? Also thinking about some of these transient college populations. I was reading, I know that there's work right now happening on how many college students are actually able to access SNAP benefits. Do they know about it? Are they actually going for these resources? And so can someone talk about kind of access to SNAP and how broadband and kind of general knowledge plays into who's getting those programs?
I'll just say that, there are definitely gaps and there are issues to resolve. I know that MU Extension has a big push right now to help facilitate conversations around broadband and help expand broadband. And I think it's part of some of our stimulus funding that's coming to Missouri from the federal government. So that will help. I know there are also efforts related to SNAP outreach. Different organizations hire people to go and help people sign up for SNAP. A lot of times that's done on more of kind of a face-to-face type arrangement at food pantries or other places where people might be who may qualify for SNAP. But, I think it's also could be part of a policy discussion too. How can forms, applications, and the whole process be simplified, perhaps providing a type of kind of uniform application for different programs. So I think there's really a lot of opportunities there for improvement.
I think this partially comes back to the kind of attitude of how are you viewing that benefit? Again, when I'll send students out here in a local rural community like Phelps County or surrounding counties, they may be aware of them, but may not sign up for them intentionally because of how they've stereotyped them in their minds. And so that's very fascinating, right? And so you think about some of the larger political discussions that come in there, you can maybe see where people say, well, let's attach a certain requirement of what you have to do to get such and such benefit. If your mindset is that you have to earn something to be, as opposed to your mindset is that is part of a social safety net, you might view that same benefit in a very different way. And I think some of those issues span across our state when we try to have a one size fits all kind of solution. If you view social safety nets as part of the social contract and something that we should all be able to rely on at different periods and different seasons in our life, or you view that I always want to be earning whatever is part of my social contract, you would have a different approach to that same benefit. And it would just look very different to two people who are coming at it from different perspectives. So, it's not evidence-based, but if I were to guess, if you did something like, for every deer tag that you brought in, or for every trout tag that you brought in, you also got X SNAP benefit along with it, you'd probably see more people in Phelps County accessing those benefits, just because it would play into kind of some of the culture that they have down here. So just things to think about. And so it's, I think maybe we might need a little bit more granularity in how we implement some of the programs that are good across the state, but might look different county by county or region by region.
I'm going to take one more audience question before we close out here with kind of final takeaways and thoughts. I really love this question. This is asking if anyone can comment on what are the impacts of climate change on food security in Missouri specifically. This is something that we think a lot about with the Local Science Engagement Network, things like drought, things like extreme heat, things like flooding. So do any of our panelists want to take a stab just kind of briefly at what we think about in terms of how climate change affects food security?
We're in the winners if you look at the models going forward. I mean, if you look across the United States, we're in the winner space, not the loser space, when it comes to still being able to grow stuff. We're not going to be setting in the midst of the worst drought and the worst heat ever, but it does seem to have, the predictions do suggest that it'll have some impacts on food production, but it does seem overall, according to current models, that Missouri is a little bit more in the winner than the loser space.
Dan is probably more qualified to answer that question than many of us, but I would say too, we could think about it as an opportunity to think about how we adapt and respond to our changing world, and a great opportunity for young up and coming scientists to think about how do we do that.
Fantastic. All right, I want to go around in this last 5 minutes, give each of our panelists 1 minute. It looks like Representative Collins was foiled by technology today, so we'll do our best to reach out to her and maybe get some comments later. She's done a lot of work I recommend looking at. She sponsored a bill last year about tax credits to incentivize some kind of increased food access in this space. And so we'll do our best to kind of connect you with some of her thoughts. I would also encourage you, if you use social media, to check out there. She's talked to us a little bit about what she likes most about her job and what she thinks about as kind of key takeaways here. So in this last 5 minutes, let's go around. We'll start with Kelly. And if you want to just take 1 minute to share kind of any final thoughts, things that you wanted to talk about, but maybe we didn't get to today, closing takeaways, if there's one thing somebody could walk away with. And while you're doing that, I'm going to put some links in the chat for our post-event survey and some other resources that have been shared. So yeah, I'll hand it over to Kelly for final thoughts.
So something I hope people really walk away with and understand is the fact that these issues, the communities that deal with not having the choice, the options when it comes to healthier options, it's by design. This isn't something that just happened. And I think really looking at again, looking at past policies and really dismantling those by, again, working collaboratively with community members, with our business leaders, with our researchers, right? And also with our decision makers to figure out how can we dismantle that and recreate and re-envision systems, including the food system that truly serves everyone. So I want to put that out there.
Fantastic. Next, we'll go to Bill.
Thank you, Brittany. I will just say that this is a big, complicated, complex issue. And as we've discussed today, just in our hour together, we have different ideas and viewpoints, and there's a host of different solutions. And I would just encourage us to keep that in mind. You know, these issues can't really be sort of boiled down to any sort of single one sort of solution. And so keeping an open mind and definitely, as we've discussed already, the community engagement, community leadership, community input is really critical in this discussion.
Dr. Barnage.
Yeah, I would just lift up what Kelly has already said in terms of that this is by design, and also maybe a little bit of what Dan talks about as well in terms of context matters. And we need to be thinking about both of those things. And I guess the last thing I would add is that when we think about food access, we need to expand our thinking well beyond grocery stores. That might be what we can go to a atlas that tells us what a food desert is, but that's pretty one-dimensional in terms of that's one place people get food. It is not the only place.
And next to Dr. Other.
I would say that in my mind, one of the things that we need to grapple with that we didn't really touch here is the question is access to food a human right? And those really deeper ethical questions, right? I mean, most of us expect that when I pick up the phone and call 911 and I ask for emergency services, that something will be there. Or if I get in my car and drive on the road, that there is some service to be there. And I think when we look at where we're at in the United States, to ask the question, if somebody in the United States is hungry, and why is that, and why aren't we fixing that? I think we need to start thinking about food as a right, and we need to start thinking about what that would mean for us, and how do we provide access to many, many rights, and food being one of those. And so that's a deeper question that involves, you know, not just us as science and community experts, but also, you know, theologians and ethicists and community members to really, you know, to really grapple with some of those deeper, meaningful issues as well.
All right, we have managed to just finish right at time, which is a real accomplishment. So I just want to use this last 30 seconds to thank our wonderful panel and thank our participants here today. It was great to have these different perspectives on our panel today, and to have this great group of people listening in and asking questions. I put in links for the post-event survey. Next month, our roundtable is going to be on January 12th, talking about the connections between climate change and public health. So kind of starting to get at one of those last questions that we just talked about today. And then the very last thing I want to share is a science note, and that's the link I just posted in here. We had one of our community members, Jasmine Yu, who's a graduate student at Texas A&M, actually work on a community science note talking about food insecurity in Missouri and what we know about urban agriculture as a potential policy option to address food insecurity. So thank you to Jasmine, I believe she's on this call right now, for your hard work, and to our editors for editing that note. Please take a look at that note. We will share a recording of this event and the science note via email with everybody. So it's always hard when we can't do claps on Zoom, but thank you again to our panel. If anyone is interested in staying around for about 10 minutes to chat, otherwise I know it's a busy afternoon, so feel free to head off to your next thing. Thank you again, everybody, and have